Good afternoon. We are back with What Matters Gulf Coast. And we have our extra special Sundays, the last Sundays in the month, and our extra special guests. This is Health and Mental Health Sunday. So we have our resident experts, Miss Alicia Richardson, who will give us the insights on the mental health piece, and Miss Yolanda Long, who will talk to us about our health needs. And first on the agenda, we will have Miss Alicia Richardson, who will give us some mental health insights. Miss Richardson.
Well, good afternoon. And so today's mental health talk will focus on self-awareness and mental health. And as we continue the conversation about mental health, it's important to address and remove the stigma that is associated with mental health with the hope of tearing down the walls of shame associated with mental health/mental illness. Often people do not address mental health and mental illness separately. And having this open dialogue about mental health gives us the space to talk about mental health, which also aids and helps in the healing process. We are often afraid of what we do not understand. Talking about mental health helps to debunk the myth of mental health and mental illness. In developing a proper understanding of mental health and mental illness, we give individuals permission and freedom to address their mental health needs to promote healing. People are multidimensional. The whole person encompasses thoughts, feelings, and behaviors. Thus, these areas of life comprise mental health. A good mental health definition includes how people think, how people feel, and what people do. Mental health includes subjective well-being, perceived self-efficacy, autonomy, competence, and self-actualization of one's intellectual and emotional potential, which determines how an individual handles stress, interpersonal relationships, and decision-making. We are not alone or isolated in the fact that we all have daily challenges. And although our challenges may not look the same, they are nevertheless our challenges that must be overcome to continue our journey in life. Life is complicated, full of ups and downs and pains and joys and twists and turns, triumphs and setbacks. Sometimes things go well and sometimes things go poorly. Mental health is not all or nothing, and mental health does affect every person, all segments of society, regardless of age, gender, education, or ethnicity. Mental health problems can negatively affect our thoughts, our emotions, and behaviors. However, no matter the nature of the tough times, we can all take charge of improving our mental health. Our definition of mental health is someone's state of emotional well-being, that subjective feeling of contentment and life satisfaction despite the problems, challenges, and upheavals of life. This conversation attempts to promote healing by supporting and sharing wellness strategies. Having good mental health does mean that we become attuned to our thoughts and test them for accuracy, that we develop a wellness toolbox of strategies that will help us move up the continuum toward our personal definition of optimal well-being. We must recognize the mind-body connection and that improving physical health also improves mental health and vice versa. Self awareness is a key component to understanding and meeting our mental health needs. Self awareness is how an individual consciously knows and understands their own character, feelings, motives, and desires. It is recognizing, self awareness is recognizing when things are not right and knowing how or what you want to improve. Self awareness is shining a light on the parts of your internal world that might otherwise be buried or pushed aside or go unnoticed. Your internal world just means your thoughts, your feelings, your physical sensations and urges. And aware of these aspects of yourself is the first step to growth and change. The benefit of being self aware is to stay mindful in the present and learn how to manage demanding situations. To be mindful is to take the time to understand these demanding situations and why we feel the way we do about them while examining our response to them. Self care is another key component of taking care of our mental health. Self care is not about spoiling yourself. It is about taking care of yourself. Self care is often associated with bubble baths and getting your hands, your feet, your hair done. And although these activities may produce a feeling of relaxation or enjoyment, the heart of self care is about taking care of your health and learning to say no. Learning to say no is an act of self care. Self care is about knowing your limits and taking care of your body, getting enough sleep, and knowing when to rest. Paying attention to your thoughts and feelings, noticing why you think and feel the way you do, noticing your feelings without judging them. You can try writing journal entries to reflect on your thoughts, feelings, and experiences. By doing this, as much as we may wish it were, humans do not come with built-in memory storage and playback like a video camera. Journaling is a way to capture specific moments for later reflection or just remembering what happened. Either way, it is an excellent strategy for improving your awareness of self. You want to spend time in solitude. A fantastic way to connect with self is to spend more time alone. Make a commitment to doing something by yourself at least once a month. This can be as simple as reading a book or going for a walk or taking a bath without distractions. Being alone does not mean you are bored. It just means there is no one else around. As you become more comfortable with solitude, you may want to start exploring your surroundings more often on your own. Go on day trips and visit unfamiliar places. Start photography and document the world around you from your perspective. Keep track of what you see and think about in later a journal entry or a meditation session. The more you practice spending time alone, the easier it will become for you when trying out new things for yourself. Observe your interactions with others. Pay attention to how you interact with people in real life and how those interactions make you feel. Notice how you react to certain. To improve your self awareness, start taking notes of how you react to certain situations. Pay attention to yourself can help you learn more about yourself. Knowing yourself can help you make better life decisions. For example, if you're highly introverted and find collaborating with people extremely stressful, it might not be the best idea for you to start a business selling products at a farmer's market. Now, here are some questions that may help you guide your reflections. Ask yourself, what is important to me? What do I want out of life? How do I want to be remembered and what are my goals? What do I How do I react when things go wrong? Do I blame myself or do I blame others? What is my purpose in life? Why am I here on this earth? Self-awareness leads to good mental health. Self-awareness can help address mental health issues. You are not alone if you have poor self awareness. A lot of people do not know how to recognize and manage their own emotions. Being more self aware can help you connect with others, it can help you become a better leader, and it also improves your mental health. Self awareness is key to healthy functioning. And so, to conclude, I want just to just encourage you that self awareness does lead to good mental health. And it is important for our functioning. It does take courage. And you're not always going to like what you find, but that's okay. Self awareness and mental health are intricately linked, and the ability to be aware of your own strengths, your weaknesses, your thoughts, and fate is called self awareness. So, in this sense, it is a personality trait that everyone has at various levels. And those who are more self aware tend to have better mental health because they actively improve their lives based on what they know about themselves. It is important for you to take the time to think about yourself and understand your own thoughts, feelings, and beliefs. And this will help you develop positive self awareness, which in turn increases your happiness. And this has been your mental health moment. Have a great month and take care of your mental health.
We want to thank Miss Alicia Richardson, who is our residence counselor, speaking to us about mental health. Please remember that Miss Richardson is available. Can we put that back up? Miss Richardson is available for counseling. She does do private duty counseling, and her contact number is 251 753 0668. And one of the things I'll say before we go to our next guest is that we as a group of people are beginning to open up to these other kinds of services like the counseling. We are finally realizing that, yes, it may not be a bad idea to go talk to that impartial person to help us through this. So, if that's your case, give Miss Richardson a call. She does do the private duty counseling, so give her a call, okay? Our next guest, in following with our Mental Health and Health Week, is Miss Yolanda Long, and she's going to give us the latest in terms of the health updates. And I'm hoping she's going to talk a little bit about this new vaccine. Miss Long.
Hello. It is a pleasure to be back again. Um, if we didn't learn anything from the pandemic, from the COVID-19 pandemic, what we should have learned was better access to care. But it seems that we have not. And with that said, here we go again. When we think about health, we think about social determinants of health and how that affects us. And social determinants of health are the conditions in the environments where people are born, live, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. And we've all known for a very long time that your economic situation affects how well you age. Because if you don't have access to your medications, access to going to the doctor, that's an issue. We know that education plays a big role as far as access and quality education. When we go in and speak with our healthcare providers, we want to understand what they are saying. And a lot of times, people don't have the know-withal to go in and the wherewithal to go in and talk with their healthcare providers and explain what's exactly going on. And another problem we have on the opposite side of that is healthcare providers are not supposed to use medical jargon when speaking with patients. They're supposed to speak to the patients on their level. The third thing that's big on the social determinants of health is that access and quality health care, and that's what I'm here to talk about today. With this monkeypox virus, as it has come out, we are finding out that the Biden administration states that the United States has become the global leader in infections. The administration also said Friday there's enough monkeypox vaccine available now, but the health officials say the shots aren't getting to some of the people who needs them the most. About 10% of monkeypox vaccine doses have been given to Black people, even though they account for 1/3 of U.S. cases, according to the Centers for Disease Control. That's an issue. If you think back to COVID-19, we had this issue where if you lived in the more astute neighborhoods, you were getting the vaccines in a timely manner. It took a while for them to trickle down to the poorer communities. And then when it came to those poorer communities, it was, how do we get it out into the actual community? And we're having a problem with this. Another thing I would like to discuss is equity. When it comes to health equity, there are a lot of disparities in healthcare. We fall way below the equity margin. And so we need to come together as a community. We need to come together when they are having meetings on, become involved in the city council meetings. These are your governing officials. We need to start at the bottom to work our way up to national. We have to do the grassroots in our community. We have to be the voice. We cannot wait. Superman is not coming. We have to save ourselves. And so we have to become involved. We have to become active citizens. We have to become active and accountable for our own health. But I found out there are 2 locations that are giving out the monkeypox vaccine that I know of. But Bebop's Bar downtown, they are located at 213 Conti Street, Mobile. They will be given the monkeypox vaccination on September the 1st from 4 p.m. to 7 p.m. This is open to the LGBTQ plus community. This is because a lot of people have not come out with their sexuality. A lot of people fear judgment of going to the Mobile County Health Department. That is the other place that you will be able to get the monkeypox vaccination. But you have to meet a certain criteria for both places. If you go to Bebop's Bar downtown Mobile, you have to be a member of the LGBTQ plus community. If you call 251-690-8889, that's Mobile County Health Department. Clients, you must be a client that's taking part in the Family Health Ryan White program, and they will set you up for an appointment. And I want to dispel misconceptions about monkeypox only affecting homosexual men, because that is not true. Monkeypox can affect anybody. It's just more prevalent now in the homosexual male population at this time, but it can affect anybody. So we need to dispel some of these healthcare myths and go with solid information. I also want to inform you all that It's almost that time. It's almost flu season. And I recommend everyone get the influenza vaccination. Number one, a lot of people I know you heard during the epidemic, they were saying, well, people die of the flu all the time. Yeah, that's true. People succumb to the flu, but usually it's not the flu that they succumb to, it's that secondary pneumonia that they eventually pass away from. So I'm encouraging you all to get your flu vaccinations. And I'm also encouraging you to get your pneumonia vaccination, because flu and pneumonia is a deadly mix. And we must not forget, COVID has not gone away. We still have COVID positive patients in the hospitals. They're just not broadcasting those cases like they were at the height of the pandemic. But people are still admitted. People are still passing away, succumbing to COVID 19. So I implore, please get your COVID 19 vaccinations as well. We have some key things that are coming up this month. One of them, um, we try to highlight the awareness issues that's going on every month. So, in the month of September is National Suicide Awareness and Prevention Week. It's also Blood Cancer Awareness Month, Food Safety Awareness Month, where we want to learn more about foodborne illnesses, how to clean, separate, cook, and make sure you chill your food after you cook it before refrigerating it. Make sure you put it in let it sit out, not a long time, but enough for it to cool off before you put it into the refrigerator. And how to properly prepare foods so you will not mix like chicken and ground beef, or chicken with your vegetables, raw chicken, that is. And not just foodborne illnesses. We want to talk about nutrition, what's healthy to eat, what you should be consuming. We want to discuss healthy aging during the month of September, because a lot of elderly people are living alone. We want to make sure they have homes that are safe, they're well lit, no carpet or rugs on the floor that they can trip on. They have good fitting shoes. They're able to sustain themselves at home. They can cook, clean, and bathe themselves. And if they have people coming in to do that, that they are doing what they say they're doing, what they are obligated to do. So we want to make sure our elderly age in a healthy environment. We want to make sure they stay active, they socialize, because with aging, you don't just have to stay in the house and age in place. Go out, be active. And I know since the pandemic, everybody pulled back from socializing, but we can still wear our masks. It's up to us to protect ourselves. When you go out, wear your mask. I still wear my mask. And we want to make sure they have all the medications they need, they're exercising, and they're well involved in the community and well integrated into the community. We don't want to throw our elderly away. We want to wrap our arms around them and embrace them and bring them in. It's also National Childhood Obesity Month. And now is the time to, look at labels when you're going to the grocery store. Not only are you trying to make sure you're living healthy, but you want to make sure your children and grandchildren are healthy as well. Make sure they're participating in extracurricular activities and not just playing PlayStation and Xbox. So we want to get them out and get them active. It's National Recovery Month for those that are survivors of drug and alcohol abuse. So we want to become aware. We want to encourage. We want to rally behind. We do not want to tear people down. We want to say, way to go. I see you. You're doing good. Great job. It's also National Sickle Cell Month. And we want to bring awareness to sickle cell, and we want to bring awareness to organizations and groups that are caring for our sickle cell patients. We have the Sickle Cell Foundation, and if you want to get involved with the Sickle Cell Foundation, reach out to them. They do after school programs, they do tutoring. So now would be a good time to reach out to them. I'm pretty sure they'd appreciate it. It's Ovarian Cancer Month, and it's also Polycystic Ovarian Syndrome Month. And that's one I really want to talk about because mostly it affects African American women. And the most, when they find out that they have the disease, is when they're trying to become pregnant. They're trying to start a family, and they've been trying for a while, and they just don't understand why they cannot become pregnant. And some symptoms of polycystic ovarian syndrome are missed menstrual cycles, irregular menstruals, or very light menstrual cycles, ovaries that are large or have many clots. The patient may have excessive body hair, including on the chest, the stomach, or the back. Weight gain, especially around the abdomen. Acne or oily skin. And they may even present with male pattern baldness or thinning hair. And so the biggest concern with this is infertility, but there are other things like they're more prone to hypertension, diabetes, hypercholesterol. And so it affects a lot of systems. They may even have dark or thick skin patches on the back of their neck, in their armpits, and under their breasts. So a lot of people don't realize they have this disease or this syndrome, like I said, until they get ready to have children. But there's help out there. Please go in and speak to a gynecologist, and they can, if you need further testing or intervention, they can help you. Another thing that's going on this month is Sexual Health Awareness Month. What we want and encourage everybody to do is make sure you go and get your annual pap smears. Make sure, not annual, they're doing them every 5 years now. So if it's time for you to do your pap smear, go in and have your pap smear done. Go in and have your sexual health test done as far as your STDs and STIs. You want to make sure that you are doing your self-breast exams. That's part of that. And men, I want to encourage you to do breast tissue exam as well as your testicular exams. And the last thing on the list for September that I have is World Alzheimer's Awareness. And each and every one of us, I'm pretty sure, have been affected by someone who is living with Alzheimer's. And that's all I have for you all this month. And thank you. And I'm glad to be back. Have a great day.
Thank you so much, Miss Young, Miss Long, Yolanda Long. We appreciate that. You always brings us helpful information and help to keep us on target. That concludes our show for today. And we want to thank you, our audience, for joining us today. And please be with us again next Sunday at 4 p.m. Thank you from our producer, Miss Susan Johnson, and myself and the staff for What Matters Gulf Coast, and good afternoon.